We're getting started. What are you doing?
What? I'm vaporizing. I thought that's what we're talking about today.
Nope.
No?
We're doing vaping, dude. Vaporizing.
I'm so embarrassed.
Oh my god.
Well, tell me a little bit about vaporizing. I'm gonna leave this here.
No, vaping. Dude,
Oh,
vaping. Yes.
Okay.
All right, now that we're all on the same page, we're going to be talking about vaping because it's something new and trendy, right?
Okay.
By new, it's about 2007 is when it kind of kicked off into the market, right?
So relatively new.
Exactly. And it basically came about to be a healthy, I air quote that, healthy alternative to traditional cigarettes. Especially to help people potentially quit using or, stop altogether kind of thing.
Sure.
The problem is that a lot of people really don't know what's in vaping. And I think that's what we're here to kind of reveal more because we're concerned about the health effects with it, especially the dental health effects. So, speaking of, unfortunately, not knowing about what's in it, it's because the manufacturers aren't required to disclose what's in it. That's unfortunate. So what we found is that actually, at least 99% of these, e-pens, e-cigarettes, whatever you want to call them, have nicotine.
So this is a makeshift one. This isn't a real one. Just a lighter.
Yeah, they don't have it.
But it kind of looks like a vape pen or a vape stick.
Mm-hmm.
And like Dr. Yanez was saying, the FDA doesn't require a reporting on ingredients.
Mm-hmm.
Okay.
And some of those ingredients, though, that we found are volatile organic compounds, cancer-causing chemicals, heavy metals, ultrafine particles, and flavoring chemicals like diacetyl, which lead to a serious lung disease, correct?
Yes. Irreversible damage to your lungs, this one particular compound.
Yeah, and since users are starting this at a younger age, irreversible effects like that are then going to be more serious because you've exposed your body to them for a long time.
I mean, as young as 12 years old we hear, 11 years old, it's pretty staggering how
it definitely
young.
is. And actually a recent poll on teen users was that almost 70% of them thought that it was just flavoring.
That's it?
That's it. Like, oh cool, it's just vanilla, it's just apricot. That's it.
Not harmful at all. That's
No.
the perception, and that's what these advertisements are kind of
exactly.
making people think.
But
right?
just to name a few scary chemicals that we actually stumbled upon are ethylbenzene, and if you don't know what that fancy name is, that's something found in paint.
Wow.
Okay. Acetone. I only use that on my nails because that's nail polish remover. Not something that we should be vaping. What are some of the other ones?
And then antifreeze, propylene glycol is found in antifreeze. That's one of the big components in your vaping pen.
Yep.
Okay. And then,
formaldehyde, embalming fluid. Yep. I wouldn't want to hear about that one.
And then firework ingredients such as ribidine.
And the other one that should be obvious is nicotine. Like you mentioned already, 99% of these actually contain nicotine.
So we'll briefly talk. Nicotine is a drug, just like any drug. It has an effect on our brains. And being a younger adolescent, it has more of a harming effect. It affects your blood pressure. It gives you anxiety. It also changes your heart rate. It could give you arrhythmias, which is something that's a little scary for a young developing mind. Okay, so these are things that we have to think about when we're pumping this into our body at such a young age, 12, 13, 14 years old, and we're creating a dependency for life because nicotine in one Juul pod, what did we say, is about 20 cigarettes worth of nicotine.
Yeah.
Okay.
And I was looking up that some of the users admit to using a whole pod in anything as little as a few hours to a few days.
Wow.
Right? So if it's a few hours, that's a lot of traditional cigarettes and nicotine.
And you're setting yourself up for addiction in the future then.
Yeah.
Okay.
And obviously it's a no-brainer with everything that we kind of just pulled out and said, names of ingredients, that it's a harmful thing to your health, right? There are many risks involved with that. But what a lot of people always forget is that oral health is related to your systemic health, right?
So how does it affect your oral health?
Exactly. So huge effects on oral health, and some of them, the main one that's a huge side effect is dry mouth, what we call xerostomia, right? And why is dry mouth a concern when we see a patient?
Dry mouth is going to make you more prone to getting cavities because the saliva is there to buffer out any acids that we put in our mouths, what we eat. And if we don't have that, we end up getting, gum recession and more importantly, cavities which are something we always want to avoid.
Exactly. We don't want to be doing something that's going to suppress those defenders.
Yep.
When those are natural defenders found in our mouth, right?
And more plaque accumulation.
Exactly, because actually certain flavoring combinations in vaping have been proven to increase microbial adhesion to enamel. And we always worry about any sort of plaque, tartar, anything that's adhering to your enamel is not supposed to be there. We're supposed to have glassy, smooth teeth, right? So the rougher and more adhesion we have of a layer of anything is going to cause things to stick more. So that bacteria, and so we're going to have an irritation to your gums and potentially, again, cavities, which could be more rampant, right?
So things we want to avoid. And vaping is not helping the situation out.
No.
So
now that we know the potential effects that it's really even having on your dental health as well, we're like, hey, this is something we really got to kind of address because we don't want to see more patients coming to us with these issues.
Correct.
Of course we want to help someone, but if we can minimize the amount of issues, that'd be great. You know, the problem is that there's a lot of models out there kind of saying, hey, this is a good thing, this is a good alternative, but
so a lot of celebrities and endorsers like Leo here and Arnold, and when kids at a young age see their people they idolize, role models, what are they going to say? Hey, I want to do it too. It's just a plume of liquid water.
Yeah.
What's it going to do?
Hey, but maybe we can serve as a good alternative role model and say, reconsider, learn before you go put something in your mouth.
At least know what it is that you're doing and what it could cause.
So hopefully we've shined a little light onto it. And next week, what are we shining a little light on?
We're going to talk about marijuana, which is a new topic in Illinois.
Yep, another trendy thing, guys.
So we'll be touching things of dental consequences and what to know.
Yeah,
for next
absolutely.
week. Okay.
All right, cool. We're going to take a couple of puffs of this vaporize you bought in. Might as well, right?
That lavender is so calming.
Get ready for our day. Let's go.
All right, guys.
Bye.